Is the health department seeing the same trends? To let us know their take, we talk via phone to Health Undersecretary Leopoldo Vega. Secretary Vega, welcome to the big story.
Good evening, Robin, and to all the listeners out there.
Usec, we're taking note of these, hopefully optimistic projections from OCTA Research, but we're also taking note of this at the time that mag-uumpisa pa lang tayo sa MECQ. Are you seeing the same trend, and will this trend hold even under MECQ?
I think for the last 2 weeks, we have been able to control the mobility of people interacting around. And we know that there has been a slight progression in terms of making sure that the minimum health standards are there. And not only that, we have seen that the suppression of the virus has been very significant. In fact, in OCTA Research, they were able to find out that the R0 has significantly decreased. So with the continuous application of the minimum health standards, and of course the making sure that testing is there. In fact, we are now rolling out the testing for especially in these highly prevalent areas with antigen. Then we will be able to make sure that we can isolate the significantly the positive people and contact trace those who have been in contact with them. So if we are able to maximize contact tracing, testing, and of course isolation, then the suppression of the virus can happen, meaning to say suppression of the transmission, and the probability that the R0 will be below 1 is there. As long as we have these initiatives, all of us will have the initiatives of really suppressing the virus.
Okay, now Usec Vega, on the other side of this, as people have been reporting, bumababa yung R0, but sa fatality rate sa COVID-19 cases, medyo tumaas ng konti by about 0.2%. Now, experts are saying that could be attributed to either of two things or both. It could be variants, although they're saying there's not enough data on that. The other thing is they're saying stretched ang ating public health system, obviously, and that might be leading to a slight uptick in fatality rates. Are we ready is the public health system also improving its capacity again so that we can continue this trend of bringing down fatality rates as well?
Yeah, I think so. I think we have been looking at the mortality rate as significantly in the below 2%. In other words, this is roughly between 1.7 and 1.8. And definitely comparing it with last year, there is a bit of an uptick. But it means only that the uptick could only be that this could be possibly be involving a lot of elderly people who have been contacting the virus. And second, I don't think it is really that significant in terms of the mortality, since we have, I know the healthcare workers have already experienced, and they already know how to treat the COVID pandemic in terms of critical and severe patients. And basically, the clinical guidelines are there, and I think looking at it from this perspective, I think we have experience in terms of treating the virus, and secondly, I think the mortality has been definitely been on a fixed in a fixed rate compared with last year.
Okay, salamat Usec. That was Health Undersecretary Leopoldo Vega.